Greetings and welcome to a talk on environmental conditions and threats to the exercising patient, the exercising athlete or client, or as you see in the upper right corner, the military personnel that some of you either are military yourselves or you may be treating them. So use that as another example. We want to talk about how best to treat these people and probably more importantly, what signs and symptoms to recognize for somebody who is at risk of needing your medical attention. And so right away, let's talk about the physiology behind heat-related illnesses in particular, but also we're going to talk about cold-related injuries. So first, how does our body deal with heat? As we're exercising, our muscle activity increases our core temperature. As you know, many of us start out about 99 degrees Fahrenheit. What you might not know is that the body can elevate 3 degrees, even 4 degrees with extreme exertion, and this is normal. You see here at the top, the body can elevate even up to 104. Now that's not exactly normal, but it can reach that high. But after 104, that can really tax the body and put somebody at risk. So heat stimulates, what we know is that it stimulates the hypothalamus. And then the hypothalamus is that central brain function and organ in the midbrain that stimulates sweat. And the body, as you know, sweats to dissipate heat. This is how we cool ourselves down. And we cool ourselves down through evaporation, right? As the sweat glands produce sweat and that evaporates from the skin. This is all not news to anybody, and that evaporation cools the body. What happens though with heat-related illness is that somehow the hypothalamus loses that autoregulatory function, and a person could potentially lose the ability to sweat. And here's where the problem lies. So just to get your juices flowing, who are susceptible people? So from the top left to this bottom left, let's think about these people, okay? We already talked about military folks. What do you see in their picture to the right with the football players? How might they be at risk? Think about this. Well, they've got protective equipment on, right, which locks in heat into their body. They've got a helmet that doesn't allow the head to dissipate heat, and they're heavily muscled. The picture to the right of them, the gentleman sitting under the umbrella looking like he's in the Bahamas on a vacation. What's true about him? He's older, right? And then in the bottom left, this is the other extreme. Yes, he's a football player, a tough one at that. But he's younger. So military folks, heavily muscled athletes, and people on the ends of the age spectrum are all susceptible. So you're going to be interacting with these folks, and how can they be susceptible? Well, let's talk about ways that heat is transmitted first. And you learned this in middle school and high school, so let's just be really quick here. Heat can be gained or lost through various means. And when I say heat, I'm talking about the whole spectrum, right? Extreme cold is the absence of heat, but it's still on that spectrum. So just because I say heat, that doesn't mean 130 degrees only, okay? So our bodies gain and lose heat 4 ways. From the sun, primarily through radiation, from the air and water through convection. And here right away, I'll stop us and say that as we gain and lose heat through water or air, it increases the rate at which we gain, absorb heat, and give it off. Think about it. You're in extremely cold water, okay? Maybe you're in 45 degrees of water. You can last only a few minutes without feeling hyperthermia in water. You can last much longer in air temperature that's 45 degrees, that same 45 degrees. And the reason is convection of heat occurs more quickly. Think about this also. If you've ever been in a cold whirlpool, how long do we put athletes in a cold whirlpool or patients? If it's like 50 degrees, 10 minutes. How long do you keep an ice bag on? 20 to 30 minutes, right? And it all has to do with convection. Now, speaking of ice, conduction is that ice bag. A physical contact with another object that gains or loses heat for us. Think about it, another one, artificial turf. Some of you have memories of playing sports on an artificial turf surface when the temperature was over 95 or 100 degrees. How did that feel for you? It felt terrible, right? that artificial turf was conducting heat more rapidly, okay, at a higher magnitude. And you may have even had to have that competition canceled. Whereas if you would have been on another surface, you may have been able to tolerate better. And that all has to do with heat conduction. And then finally, evaporation, which we already said, the body's ability to lose or process heat through evaporation, cooling the skin. What I would say here is that the body's ability to evaporate heat is impaired when humidity is over 65%. Right now, as I'm giving this talk in San Diego, the humidity is over 65%. Think about that if you go out for a long run today or this week or in August or in the South. And the body's ability to dissipate heat through evaporation is completely lost at 75%. Now, my brain naturally wants to think about, okay, so what Jeff just said there is that humidity, right, and the ability now to evaporate heat is significantly affected by humidity. That's true, but there's another side to the equation, temperature. So the combination of temperature and heat is critical here, because you can go out and run in the rain with 100% humidity, but if the temperature is 65 degrees, it feels good. You could go forever. Got it? But if that humidity is, let's say, 80%, but the temperature is 93 degrees, that's a dramatically different scenario. So what I want you to hear as part of this lecture is you as healthcare and fitness professionals, as coaches, et cetera, strength and conditioning professionals, have to monitor the heat and the humidity and the combination of those two and reduce practice or cancel it altogether depending on what those scenarios call for. So let's get into the environmental conditions that are adversely influenced, or the conditions, I should say, that are adversely influenced by the environment. Heat cramps, we could go on and on here, but in general, we're talking about muscle cramps due to excessive water and electrolyte loss. Now, I skipped over a new word we need to learn, MOI. That's an acronym standing for mechanism of injury. What is the cause of muscle spasms? It's a decrease in electrolyte and or water, okay? Especially sodium. Or somebody who's sweating a lot and losing water, they're also losing sodium, and that could, and sodium is necessary for muscles to contract. So that's the mechanism of injury. Hey folks, another way to say mechanism of injury is cause, but it's also etiology. That's spelled E-T-I-O-L-O-G-Y, etiology, okay? So 3 different words meaning the same thing. What are the signs and symptoms of heat cramps? Extreme pain, immobility, inability to move that limb because the muscle is in spasm, and then a palpable knot. Okay, this is typically in well-conditioned athletes. It's not the poor athletes who have muscle cramps. It's typically the highly refined, conditioned athletes. And so, how do we treat it? Well, we could do things like water replacement, but also you should mix in some electrolyte. Try to avoid sugar, and then gentle massage and stretching. I'm moving quickly. You can spend plenty of time in the slides on your own, but I want to get through this rather quickly. If you've ever fainted in the heat, that's syncope. The fancy way to say fainting is syncope. So what is this mechanism of injury? Typically, it's somebody unaccustomed to that heat. If the heat kind of comes up on you, or maybe it's the beginning of the hot season in a hot area and your body just hasn't acclimated, and you decide, hey, I'm going to go out for a run, and typically it's fine. But not today, right? Because it's 15 degrees warmer than you thought. And you start to faint because your blood pools in the extremities, leaving less blood volume for vital organs and your brain, etc., which leads to hypotension, decreased blood pressure, and you feel dizzy, nausea, and nauseous before you faint, right? But if you keep pushing, fainting might happen, and that's syncope. So the treatment that we want to be sure to do for this athlete is to have them rest in a shaded area, out away from the sun, hopefully off of that turf if they're on the turf, and replace their fluids. Let's talk about exertional heat exhaustion. This is where we're going to spend a good part of the rest of our talk. Exertional heat exhaustion happens in any environment in which the patient has inadequate fluids. Okay, so they're losing a lot of fluids through sweating, and or they're in poor physical conditioning to begin with. In my experience, y'all, it has not been poor conditioned athletes. This has been people who are predisposed to exertional heat related exhaustion. And I'll tell you who those are in a minute, but let's describe it for you first. The signs and symptoms, they may have muscle cramps, they may be disoriented, they may be lightheaded, kind of those symptoms of syncope. But then also their skin is going to be pale and cool. This is good. We want the skin to be pale and cool because that means they're sweating. Okay. They may get nauseous later on. They may have severe thirst. They usually will have a headache because they're dehydrated. When we lose 10% of our body fluids, we're dehydrated, and that's when a headache starts. Treatment is the same for syncope. Stop exercising, get them in a cool shade, try to elevate their extremities to pull blood back to the vital organs. That makes sense, right? Like same treatment for somebody who's experiencing shock. If necessary, you want to use cool ice packs and cold water. Why cold water? Remember, it's that convection process, right? That's gonna cool the body more rapidly. And they may need medical attention if no improvement. Now, that was heat exhaustion. Let's talk about the most extreme heat-related condition. And probably all of you have heard of this. This is exertional heat stroke. Why exertional heat stroke? Because that's different than what you might have heard of as classic heat stroke. And I'll get into the details in a minute. The exact cause of this, and remember we said we don't quite know why the hypothalamus stops regulating core temperature, but it does. And so technically, exertional heat stroke happens when the body's core temperature goes above 104 into that 105-degree range. Now, this is when a patient is very susceptible to life-threatening conditions because their body will start to shut down. This is a medical emergency, okay? What are the signs and symptoms? Well, in addition to everything we already said, they could become disoriented as their temperature elevates and incoherent. Maybe they're just kind of, moaning incoherently and confused. Their skin is going to be different. It's not cool anymore. It's hot. Okay. It may not be wet. It might be dry and it's red. And their pulse is just hammering. Okay. So as you check the radial pulse or the carotid pulse, you're just going to feel it hammering. Why? As our core temperature elevates, our heart increases blood flow because it's trying to push blood to the extremities so that blood, the increased blood volume, can carry the heat through the capillaries and get rid of it. What we're talking about here with stroke is the loss of the ability to get rid of heat. So the body just internalizes that heat. So the pulse is just strong. The skin is hot because they're not dissipating heat. We've got to activate EMS, call 911, and then the very next thing, I'm going to preach at you for a minute here because I want you to save people's lives. Evidence says that the very next thing you should do before EMTs arrive and paramedics on the scene is immerse this person in as much cold water as you can. By cold, I mean about 40 degrees or 50 degrees, okay? That's like ice water with ice floating on the top, not melting, okay? And I have resources in the module on technical position statements. You can read about this if you're interested, all the details on how to treat these, particularly if you're in the medical community. But the evidence says that the quicker we put these folks in cold water, the higher probability is that they survive and that they don't have organ failure. So that's what we're talking about here. So this is an old slide, and I say that because I want it to help us to differentiate heat stroke from heat exhaustion, but I also have the next slide that even takes us further based on what the evidence says. But in general, if you're talking about a patient or a client who's exercising and you want to determine if they're at risk, the person who is most at risk is the person who isn't sweating profusely. Maybe they're sweating less. That's one area where this picture is not accurate. People with heat stroke still sweat, it's just less, but their skin is red and hot, okay? And if you take their temperature, it's above 103, 104, it's getting into the 105 range. Heat exhaustion, this is the person with moist, clammy skin that's able to sweat, and then that's a different treatment, not a medical emergency, unless some of these things on the left side start happening. Now, here's a slide I've added over the years because we've learned more and more about heat stroke. There are two general myths going on among even educated people. The first is that people with heat stroke don't sweat. We just said that they do. It just could be lessened, all right? This is different with exertional heat stroke in the exercising patient, okay? Traditional heat stroke, which tends to happen to very young and very old compromised patients, they may not even be exercising. These are the people who you unfortunately hear about die, you know, in extreme heat waves, whether it's through the South or in Arizona, et cetera. So victims can sweat with heat stroke. And the second one is that ice baths are harmful and they may cause shock. Well, cold water immersion, the evidence shows, and you see some of the evidence down here by Dr. Yergin, the evidence shows that it can be 100% effective if done right and immediately, okay? Immerse as much of the body as possible, make plenty of ice, enough that it's still floating in the water, and keep the athlete there until their temperature starts to go down a few degrees at about 101, 102, okay? That's the treatment. One last thing that can be related, but I want to tell you about it because it's in the literature, is something that happens when we sort of overcorrect and we're trying to superhydrate. Hyponatremia. Okay, hypo means the lack of. So what is this? This is so much water in the system that the sodium content is dampened and lessened. Not enough sodium in the bloodstream due to overconsumption or overcompensation. This also can be life-threatening. Okay, so key signs and symptoms of this: a worsening headache, some of the same signs and symptoms as heat-related illness, nausea, vomiting, lethargy, and also a compromised central nervous system. Why? Because nerves need sodium for proper functionality, okay? And so this is also a medical emergency, and you need to replace sodium. If you suspect this, if you know they're super hydrated and exercising and you start to see some of this, you can give them an electrolyte, okay? Old school would just be a sodium or salt tablet. Okay, moving on. So who are the susceptible athletes? And this is some of the most important things we can tell you. Well, anybody, as we said, who's unacclimatized to heat, and I'm going to tell you how to acclimatize them. People who are overweight, because fat is an insulator of heat, so it'll lock heat in. Febrile folks, well, febrile is a fancy way to say anybody who might be fighting another comorbidity. That means another pathology like an infection, the flu, a GI disturbance. Folks with blonde hair, fair skin, freckles. I'm one of those people, at least the freckles and fair skin. I'm here to tell you, most of the people I've treated for not all, but most that I've treated for heat-related illness were fair-skinned, okay? And they have a increased probability of heat-related illness. And then in your patients, any heavy water loss greater than 3 to 5%. That's a key thing, you guys, because a body water loss of 1 to 2%, hear me now, 1 to 2%, totally normal in an exercising athlete, particularly elite athletes. The kicker here is you, as a professional, need to make sure that they replace their fluid losses. And one of the ways to do that is to weigh them before and after practice to make sure that their weight is not decreasing every day over the life of a week or two, okay, if they're under your care. So how do we acclimatize or acclimate people? Well, you know this. If you've been an elite athlete, you know, say a runner, and you wanted to acclimate to heat or cold or elevation, what did you do? You gradually performed your activity in that environment. Great. I bet you didn't do it for a week to 2 weeks. Maybe you did it for 3 to 4 days, but I'm here to tell you the human body can adapt to a change in its environment. I'm reading the definition to you. To a change in its environment, either temperature or moisture or food, gradually over time, okay? What we know from the evidence is that it takes a week to 2 weeks, all right? Even with an intensity and workout and duration. This is called the SAID principle. Your body makes specific adaptations to impose demands. As we increase the demands, your body will adapt. That's the beautiful thing. Okay, also think about the clothing that they're wearing, breathable, non-cotton, like a polyester blend fabric, Nike Dry Fit type stuff is good. Unrestricted water, and then routine thermometer and psychrometer testing. I gave you a picture of a psychrometer. What's the beauty of the psychrometer? It's more than the thermometer. It measures ambient air temperature, but then also humidity, and spits out a formula to tell you if your athletes or patients are at risk. Highly recommend you invest in one of these if you're monitoring athletes in certain parts of the US and the world that are prone to high heat and humidity, right? Here in the US, it would be the southeast, right, of the US, and other states. California, San Diego, we get heat and humidity. So you would do that there too. All right, let's finish up heat-related illness and then go into cold. Preventing heat illness. You could spend a lot of time here. Let me just highlight it for you. For those of you who are going to be working with these types of patients and athletes, it's your job to measure the temperature and humidity. We already said that. We already told you what the danger zone is. You should monitor weight loss and body weight after activity. Weigh your athletes before and after practice. At minimum, at the beginning of the day, at the end of the day, and then the next day in the morning to make sure that they've replaced. 1% body loss weight loss is fine. 2, 3, 4, 5, 6%, not fine, okay? And then allow rest periods between practice in a cool shaded area to and encourage fluid and electrolyte replacement. We usually do a half and half water to electrolyte. So just take a typical electrolyte drink and water it down halfway. That reduces the sugar content as well. Couple cool slides for you just to go and look at the evidence. You can click on this slide. Lynn Kravitz is an exercise physiologist out of New Mexico. But he tells us a person can lose up to 2 liters of water per hour. You know, that's more of a heavily muscled person. So the moral of the story is, I mean, you think about these people who are doing cycling in a hot environment, you know, I don't think Orange Theory does this, but some other clubs might. These are the criteria that you should use for appropriate fluid replacement. I'm not going to read them to you, but I'm going to give you a spoiler alert. Probably none of you are drinking this much fluid when you're exercising for longer periods of time, but make sure your athletes are. And then another, just for fun, for those of you who are not lactose intolerant and you can handle milk, regular milk, chocolate milk appears to be perhaps not nature's perfect recovery drink, but it's very good as a recovery drink and probably better than water because it has electrolyte and potassium in it. Now you can find some substitutes that have that added, but if you can tolerate milk, this is actually a perfect carb to protein ratio as well. So for recovery, it should be about a 3 carb to 1 protein ratio, which it turns out milk is the perfect recovery drink. So, but of course, if you can't drink it, don't drink it. Let's talk cold, okay? Let's talk cold related illnesses. We're gonna go quickly here because these are less prevalent, particularly as you're in the US, in the Southwest. But hypothermia is any condition involving low temperature with a high wind chill factor, again, right? Conduction or convection of heat. What are the signs and symptoms? Surprisingly, some of the same as heat-related illness because your body treats extreme weather conditions the same. Fatigue, an altered neuromuscular response. Here it's decreased. And an important note, when the body goes below about 90 degrees, you could actually lose the ability to shiver. Our bodies, as it turns out, are pretty temperamental and like kind of about a 10 to 15 degree range of temperature, right? Have you ever noticed that? If the temperature in your house goes above 75, 76, you want the air conditioning on. But in the wintertime, if the temperature drops below about 65, you want the heater on, right? So that 65 to 76, about 11, 12 degrees is our sweet spot. Higher than that, and we want to shed clothes. Lower than that, and we want to add clothes. Well, the same thing happens, or the same thing should apply for your exercising patients, right? Have them layer clothes. Clothing is important in heat and cold. Okay. Moving on, you see treatment there. We can remove them from the cold and we can add heat in this case, whether through clothes, warm blankets, or drinks, which elevates internally. Let's talk real quickly about frostbite. These are physical manifestations on the skin of extreme exposure to the cold. Here you see his skin appears pale, cold, hard, waxy. They lose feeling towards the end stages. They may have blisters. The treatment is to rewarm, recirculate, or reperfuse blood into these tissues. A note here, y'all, a deep frostbite can be characterized by tissue becoming that gangrenous or starting to die. It's like this grayish, whitish, green sometimes, but gray-white tissue death starts setting in. And this is a medical emergency, obviously. In the same way that heat-related illnesses require appropriate apparel, so do cold injuries. So you see here, waterproof and windproof clothing that allows sweat to evaporate and don't lock that water in are very good. Thin layers, and then as you warm up, you could peel those off. And then I would say here, some of you probably know this if you've studied like emergency wilderness medicine, and it might sound counterintuitive, but even if you're ever trapped in cold, it's important to stay hydrated and actually to drink water. Maybe it's snow melt if you're trapped, right? Because a hydrated body is better able to regulate extreme heat or extreme cold. So avoid dehydration is the moral of the story. Let me say a couple things about asthma just to throw this in, because if you're treating exercising athletes and patients, some can have exercise-induced asthma. Some can have asthma related to extreme cold. Both of those can trigger, okay? So what is asthma? It's a pulmonary disorder characterized by airway insufficiency or obstruction that results sometimes from an allergen, a seasonal allergy, or stress or anxiety, or the exercise itself, or some smoke in the air, or extreme temperatures, okay? What should we do? Well, the most common treatment is to rest and relax, but if that's not working, we give them an inhaler, a B2 agonist inhaler like albuterol. Some of you probably are on it, or a steroid-based that would decrease the bronchial spasm and constriction, and I'm going to show you that in a minute, okay? Side note on the bottom here, if you're an athletic trainer or a sports medicine healthcare person, please have your athletes give you a rescue inhaler, because you want to be the one to administer that to them if they're not in a position to administer it to themselves. Here's the normal bronchial airway opening. Here's the spasm caused by that clogging from a from a stressor or something in the air, or etc., extreme weather. We'll leave it here. Exercise-induced bronchospasm, we said, also can happen. This is actually a hyper-reactive response due to exercise. So some people find that they need that inhaler like albuterol before they run, okay? Given 15 to 30 minutes before they run, all right? I just wanted to throw that in there because we don't talk about this in other venues, but I want you to know that both exercise and cold can exacerbate that bronchospasm. All right, thanks for listening, and we'll talk more about this in class.